Well, hello there. How are you?
I'm doing well. How are you?
Good. Welcome to Ensuring Your Well-Being. This is Dennis James, the biking, dancing insurance man with various insurance planning. And today is going to be an excellent topic with an excellent speaker that is going to bring some information in reference to what's really important. It's called home health care and hospice care. All right, and so let me start with her unique name. Her name is Yaja Reffitt. Did I get that right?
We need a little bit of practice with
Go ahead.
that.
Tell them what it is.
All right. My name is Yaja Reffitt.
Yaja.
That's right.
Yeah, she's a Polish girl, too, so that's kind of unique.
That's right. Dzień dobry, if there's any fellow Polish people out there. Good morning.
My goodness. Anyhow, I'm really excited to have you here because a lot of people, the audience that's going to be tuning in, they don't understand a lot about that. And what I love about it is your whole background, and we're going to talk about that, but the whole subject when it comes to when you're in a hospital and you're released, how your services step in to make sure that that particular patient recipient is going to be taken care of.
Yeah, absolutely. I think it's a hard topic for a lot of people to talk about. Maybe not so much home care, but hospice.
Yeah.
It is a sensitive topic, but it's an important one, especially when we're so overwhelmed from a hospital stay. And what are those next steps? What are my options when I'm leaving the hospital? And what support do I have out in the community to get you back to your full functioning in the community?
Right.
Absolutely.
Okay. So it's kind of unique. You have a MA and a BA, so that's what, a Master of
Arts. So I have my background in Master of Arts in counseling in particular. And then my bachelor's is actually in arts as well, but with a focus in psychology and sociology with some criminal justice in that background.
Ooh, yeah, just in a nutshell, I was going to be a police officer, so guess what? It was the same thing, heading in that direction, but apparently the man upstairs had a different journey for me, so here we are today.
That's right.
So, so you have a master, and you went to Marshall University, and how did you end up going to that particular college?
Yeah. So with my bachelor's, they had a great criminal justice program. So if you're not familiar where Marshall is, we are that movie. We Are Marshall. That's the university I went to.
Okay.
And it had a really nice homey feel to it. So it just was a great fit for me at the time. And then I was actually able to extend my bachelor's into my master's program there.
Okay.
They had a great counseling program. So it was a nice, easy transition for me.
Okay. Very cool. And how many years were you there?
7 years.
7 years.
Yeah.
Oh my gosh.
Yeah, it's like my second family at the time.
That's pretty incredible, right? But with that, becomes knowledge is power, and so that's how you're blessing people today, right? You're able to take everything that you have learned, not only from going to the college to stepping into the fields of service.
Yeah,
right?
Absolutely. Started and graduated in '09, and my career really progressed from there. I started in inpatient psychiatric services, so that kind of gave me some exposure to mental health needs with every type of population, geriatrics included, and that kind of where my passion kind of stepped in. And then I transitioned to a nursing facility social worker, so that exposed me to that with working with that geriatric population.
Yeah.
And then I've been able to work over at Trinity Health. I worked home care to hospice with them. I have some experience with insurance as well, not similar to what Dennis does. He's an expert in that regards. And then currently over at McLaren, which is a health system that I'm focusing strictly on home care, palliative, and hospice services.
Right. And you're also married to a runner.
Yes, an ultra runner, a wild man.
A wild man runner, and also you get out there and you're active and you're juggling also 2 children.
That's right. Trying to balance working full time, having
Wow.
2 beautiful boys, very blessed with that, and
Good for
a
you.
beautiful home and a beautiful husband. So
Yep. Life is right. There's a
life's
lot.
beautiful.
It's a blessing,
Yeah.
right? And so, yeah. And time flies when we're having fun because I have now a 31-year-old daughter and a 28-year-old. But you know what? They're still our kids, man. We love it.
Yeah. And I'm at the start, right? The 4 and
Yeah.
5-year-old. So
Yeah.
I'll catch up.
You will catch up. Yep. All right. So let's get into just to educate people, right? So when it talks, from being at McLaren, so just which I found interesting when people are there, right? They're gonna and you're working with them, and then they're gonna be going home. So
Yep.
you want to create peace, and right, you work with family members with that. Is that kind of just talk a little bit about that? When
Yeah.
somebody's in that hospital, I would imagine it would relate to any hospital or not.
Absolutely. That's a great point that you make. So, any health system that you're a part of, whether it's here in Michigan or in another state, usually that trajectory is the same. So, you're coming into the hospital, they're planning discharge, and discharge truly happens from day one that you arrive at that hospital. With the goal of getting you home or to a community. So, depending on what your needs are, will depend on what the next steps are. So for me, I'm looking at patients that are just not coming out of the hospital, but also if they're going to a skilled nursing facility, so a
Okay.
rehab,
Yep.
nursing center, and then what's their aftercare. So that's where that home care component can kick in, and or palliative or hospice. Typically, we're seeing patients initially for home care services. And when you talk about home care, there's a difference, right? There's home
Sure.
care. So we hear home care. And that's a very broad statement, home care, because there's
Right.
skilled home care that I work with.
Right, and that's what you're doing because
Correct.
you're on the skilled. Yeah, what is the difference? So I'm glad you're bringing that up.
Absolutely. So skilled is we're billing your insurance for it. So we're getting payment through your insurance company versus a non-skilled home care. So that's a great question that, when they're trying to set up home care services, making sure that you're not refusing home care services because you have private duty coming in versus actually having that skillable need that we're billing the insurances, because you have to meet qualifying metrics
Right,
to actually have that need for home care. So it's very similar to if you're going to a rehab facility or even inpatient rehab at the hospital,
right.
you have to continuously show progress to meet that eligibility because the insurance is paying for those costs.
Okay, right. And then on the home care side, anything more on that or?
Yeah, so typically it is covered by your insurance. It is covered at 100% with traditional Medicare, but a
Right,
lot of our patients have Advantage plans or
right,
Medicaid.
right.
What will typically happen is a patient or will get notified by the insurance,
Mm-hmm.
whoever is servicing you, that you have a copay or this is how much might be part of your deductible before they start services. So that is very transparent prior to starting services, or that they only cover 15 visits, et cetera. It just truly depends on that insurance plan.
Plan, sure.
Absolutely. So that's a factor, but that is disclosed prior to starting services
Right.
with home
Yeah.
care.
Right. So there's no surprises. All right. And then also, I know the other side of the coin for you is with services is hospice,
Yes.
and palliative. All
Yes.
right. So let's go ahead and start and let people understand what palliative means.
Absolutely. Big difference between palliative and hospice.
Yeah.
Palliative, you're still seeking treatment in the community. So palliative is truly an extra layer of support. You can actually have palliative when you're receiving skilled home care services. So you're still going to your doctors, you're going to your specialists, but you're looking to get some answers and maybe symptom management for your diagnosis in the comfort of your home or in a community setting. There's different types of palliative programs. Sometimes they're video, telehealth medicine, it's a nurse practitioner or physician's assistant that is actually coming out to your home,
Mm-hmm.
and they're talking about your disease, and they're talking about what does it look like today, what does it look like in 6 months, what does it look like in a year. Those visits vary on independently on each individual's needs. So somebody that might have palliative might need a visit weekly or daily. Typically it's every 4 weeks. That's the typical program. And in addition to that nurse practitioner, we're working with your primary care doctors or specialists. So we're giving recommendations. So if you're having some type of pain or symptom management,
Yeah.
Because we're the experts with palliative and or with hospice, we're able to provide them recommendations to help treat with those symptom management. So maybe it's simply nausea and you've been dealing with that for a long time, but they're not able to find the right medication. That's where that nurse practitioner, that's her specialty.
Yeah.
She's able to come in and give those recommendations, but also communicate with your doctor. So that way it's a nice transition of care and support for you where I'm not taking away from your community some more support. I'm actually just an extra layer coming in and supporting you on where you're at. You still want treatment. You still want to be in recovery. But we're coming in and answering those questions for you. And I love it because typically they're coming out to the home. So you're having a level of comfort when you're having the conversation about maybe your COPD, right? Or congestive heart failure or cancer diagnosis. And we can meet you where you're at. There's no pressure. There's no rush. And you're still able to seek treatment regarding any type of community treatment that you're still receiving.
Right. So a lot of times when you're talking about community, we could be talking about not, this could be within a independent living community, anything with facility, assistant.
Yeah, that's a great point. Yes. So palliative is wonderful because it can go into wherever you call home. So whether it is a home environment, assisted living, independent living, a memory care, even a skilled nursing facility.
Sure.
Sometimes that can be challenging because they typically have their own providers. But depending on that community, that should not be a barrier. And that's a question to ask if you're in a skilled setting. Can I bring in palliative? I have this resource. I want my loved one or myself to have it. How do I get that here and available to me?
Okay, very cool. And let's talk about the hospice side of it.
Yeah, absolutely. Hospice, again, I'm looking for a new word for hospice because it's been so around for so long. And I think we all have our own ideas of what hospice is. I talk with friends in the community and, they still have this mindset of, hospice is the last few days of life. We pass away at the hospital. And my goal is always to educate, right? So hospice is a shift, but it focuses on that quality of life and enjoying that quality of life as well as addressing any pain and symptom management. That's a component of it, but it's living your best life possible, right? So having that quality of life, knowing that you have a diagnosis that maybe is not curable, but we're able to create memories and we're able to enjoy that quality. So you're not taking away of the natural disease process. You're letting that disease take its course, but you're having that quality of life and addressing any discomfort that you might have along that path as well, too.
Interesting that you say that. It's kind of like when people, they hear the term long-term care insurance, right away their mind goes to nursing homes. That guy in that wheelchair, right? That, oh no, But the truth of the matter is when you have a plan, it's going to keep you out of that nursing home.
Absolutely.
The facility, the benefits there, but it's the same thing, right? Oh, hospice, I'm done, dead, and there's
absolutely.
Versus giving it, looking at the, positive side of it, I guess you could say in so many words.
Yeah.
Right. The blessings of, not going through a lot of pain or whatever that would be.
Yeah, absolutely. Again, hospice has been around for so long, not long enough, but long enough to where people have their own ideas or misconceptions about hospice of it's only the last few days. A great example is Jimmy Carter, one of our previous presidents.
Yeah.
He's been on hospice for a year and a half, and people are like, what do you mean he's been on hospice? Well, yeah, because he's enjoying that quality of life, letting his disease take its natural course. But that's no different than for myself or for you when we get to that point is just having that quality of life. And what's nice about hospice is, we're not taking anything away. We're truly an extra layer support. So there's some services that go along with hospice that a lot of people don't realize that it's available to them as well, too. Right.
Now, normally, this is kind of off the cuff, but when it comes to hospice services, right, I know there's a lot of different types out there. So yours flows through McLaren Hospital. Is that correct?
That's correct. So we're associated with the hospital. And what's great about hospices is you can absolutely, no different than with home care services too, I recommend you educate yourself. There are so many hospice agencies out there.
Right.
Talk to family, talk to loved ones, talk to your community resources, but also go to cms.gov. That is a Medicare website. And you can actually do that for home care services for that skill to see what their star ratings are. So they actually publicate everything from quality to, what their metrics are on how well they're doing. What's exciting about for me for hospice is they're actually doing the star rating that's coming out this coming year,
Okay.
where they're actually going to do star ratings for hospice. So that speaks volumes. So you can get up to 5 stars. And that's an important factor when you look at that data, because then you're looking at the quality that they're providing to their patients and their family members as well. Because we're not taking care of just the patient, we're taking care of the entire family. And I think that's important to do your research and to understand when you're doing signing up for services, whether it's home care, hospice, or palliative,
Right.
is research. Ask those questions about, what are your needs and what does that look like and how can you get that right support. So
What's kind of a typical degree that somebody that specializes in home health, not so much home health care, but in hospice care or palliative?
So typically, for myself, I have a master's in counseling. So
Right.
we do have licensed master social workers as part of the team.
Yeah.
We also have full RN nurses as well as physicians that are part of the team,
Right.
chaplain services, bereavement.
Okay.
So highest level of education is really important, especially with that level of care, because we're providing education, treatment, and symptom management as well. Those are important things to look at as well. And what's nice too is depending on the program, there are additional supportive programs within that hospice company. Those are questions to ask as well when you're meeting them. It's like an interview. When I did counseling, it has to be a good match. And
Absolutely.
so, what specialty programs? Some will have veterans programs that are really important. Some will have music therapy, massage therapy, pet therapy. And those are additional extensions to hospice programs, which I love.
Right, which is cool.
Yeah.
Right, yeah.
Yeah.
Yeah, I do realize that a lot of those services do play a major factor, right, when you're looking at home health care facilities, wherever it would be, and for sure what you're talking about when it comes to, home health care or hospice care.
Yeah.
Yeah, absolutely. So is it true patients pass away sooner on hospice or what? It's a magical question.
That is. Hospice does not hasten or prevent death, but research has shown that actually patients live longer. In the Journal of Pain and Symptom Management, they compared patients that were on hospice versus non-hospice patients that actually had a diagnosis of congestive heart failure. They actually lived longer by 29 days. And people are like, what do you mean 29 days? Absolutely. So you have to think about, we're managing your symptoms. So if we're making medication adjustments, if you're taking 50 current medications, you have probably 100 side effects to those 50 medications.
Sure.
And so even if we're looking at adjusting those medications, not eliminating them all, because again, we have to meet the patient on where their needs are. I can't eliminate a blood pressure med because that's going to lead to discomfort and symptoms. So I would never do that. And no hospice should ever do that. If you have a need for a blood transfusion, there are hospices that will do that. Or if you have to have dialysis and you have a terminal cancer diagnosis, we can still probably do dialysis. That does happen now. And people are amazed to hear that, because before it was stopping medications and that mindset. And no, it's not like that. It's talking it through. I've had patients that were, paying privately for their cancer medications, and they were able to continue to do that. So it's just having conversations with the patients and their loved one to talk about what that medication and that symptom management is for them.
Okay. Yep.
So they live longer with congestive heart failure.
There you go. Well, you got to take care of that little heart,
It's a little important.
sooner, and it's always sooner than later.
That's right.
Right. Talk to your husband about that. He's active, right? Walking and running and all that. So
Yeah, the ultra
got a pretty
marathoner.
decent heartbeat going there. Got to challenge your heart too. Keep it pumping.
Yeah, it's a little scary. It gets low sometimes. His resting is at like 40. And,
That's good.
And I'm like, are you alive right now?
No,
So,
yeah, that's good.
yeah.
Yeah.
Scary for me. I'm not that good of a runner, but he is.
Yeah.
So.
Just I think being anywhere, and it doesn't, those can vary, 50s, 60s, but resting heart we're talking about there, but depending. You must be a DNR in order to receive hospice. So you want to educate the world on that
Yeah, absolutely.
Go ahead.
Yeah, so DNR, let's talk about what that means.
Yeah.
So that's a common terminology in the health field, but that means do not resuscitate. So that means if your heart stops at any point,
Mm-hmm.
do not resuscitate means that we will not attempt CPR. So that's really what that terminology means. And you can actually sign on to hospice without having a DNR. A lot of families are just not comfortable initially. It's a little bit of an overwhelming process when you sign on to hospice. And so when you talk about that is, the conversation doesn't go away because a lot of it is just a matter of education.
Sure.
A lot of people look at what's on TV, right? You watch maybe back in the day Baywatch, you do give me 2 breaths, a couple pumps on my chest, and I'll be okay. And, we're laughing at it, but that's really what happens in the community is
Yeah.
this mindset of I'll just come back and I'm back to normal. And when you talk about CPR was really intended for a healthy 25-year-old.
Mm.
And so we have to ask those questions when you talk with whether it's your primary care doctor, your specialist, even the hospice organization that you're working with. What is CPR? What is the feeding tube? What are ventilations? What happens when CPR occurs? And I think it's it's a important question to ask to educate yourself, but also understand what are what happens during CPR and what that truly looks like. And a lot of times it's just a misconception or misunderstanding what do not resuscitate means, what is CPR, what comes along with that. And it's a lot of myth busting regarding do not resuscitates.
Mm-hmm.
But yeah, you do not have to sign it initially. It's
Right.
just conversation, and we want to educate
Right.
and make sure families are comfortable with that decision.
Yeah, a lot of times when you have lawyers, elder law, right, they'll put that in writing.
Yeah.
Normally the conversation takes place ahead of time, that type of thing, but not all the time, and a lot of times it may not.
No, and it doesn't. And that kind of goes along with the advanced directives I think we were talking about too, is, having those advanced directives ahead of time. When I started in healthcare, I was in my 20s and, now I'm in my 40s. And so I think it's important. Even in my 20s, I did my advanced directives and you want to review them, but those are such an important thing to have,
Yeah.
because it really lets you vocalize what your wishes are and what your needs are.
Right.
And you're making
Yeah.
those decisions when it gets to the point where you're not able to.
Right.
Yeah.
Yeah. Then there's it is what it is, right? You can't have families saying something different, right? Right. Family members, right? When you put it in writing, that was your wishes.
Absolutely. I laugh because my husband's like, well, I'm just going to bury you. I said, no, that's not what my wishes are. And we laughed, but I had to write down those specific instructions during, when I did my advanced directives. And they don't have to be, a will if you don't want to get into the financial dynamics.
Right.
You can strictly do an advanced directive that just strictly talks about your medical decisions
Right.
and making sure you're picking the right person. And,
Right.
I've done this long enough where it's like, I picked my daughter that lives in California, but I have a daughter that lives here 5 minutes from me, but I don't want her making those decisions. So we talk about it, but unless it's written down, it's very hard to make that decision. And what most people don't realize is in a hospital setting, it is the next of kin that makes that decision typically. When you're going into a facility, like a skilled nursing facility, and you've been deemed incompetent, that's the biggest point too, right? You have to be deemed incompetent by 2 doctors before you're unable to make decisions for yourself. But if it gets to that point that somebody else is, you want to be able to vocalize that and let them know who is making those decisions for you. And it doesn't always have to be a family member. It could be a neighbor. Sometimes there's dynamics there where it just makes sense to have a neighbor or a cousin or uncle, whatever that looks like for you in your setting to make the right decisions for you.
So like paying for hospice, all right, sometimes that becomes the question. Pretty much all insurances will cover that.
They will cover hospice services at 100%.
Right. Or you got Medicare or you have long-term care insurance. But go ahead. I want to hear your point of view on everything.
Yeah, absolutely. So Medicare will cover it at 100%. Even if you have an Advantage plan, it does not matter for hospice services. And that includes that umbrella of all those services of the staff members, your medications, your equipment that's related to your diagnosis. Now, with that being said, when you talk about Medicaid, that typically covers room and board. So what happens is when you're going into a nursing facility,
Right.
and if you're not, or if you're staying at an independent living or assisted living, which surprisingly they're able to take on those patients more and more now. They're feeling comfortable taking care of hospice patients because it is a little bit of a higher level of care.
Hmm.
You're paying privately for that unless you have private insurances or you have Medicaid that's in a nursing facility.
Okay. Yeah. Right. So that pretty much covers it. There should be no reason why it's not covered somewhere.
Absolutely. Even our age, it would be covered. If I called my insurance benefits right now, hospice is a covered benefit, and they
Right.
do charity cases. That's an important point to make as well too. Is if you're working with the hospice agency, that's a question to ask them. Do you do charity cases? I don't have the insurance. I don't have the funding for that.
Hmm.
There are hospice homes out there. There also is funding as well typically from nonprofit agencies that will take on patients that don't have any benefits or insurances.
Okay. Yep. So really, you want to have everything planned out ahead of time, whenever possible, right?
Absolutely.
And what more do you feel like that you'd like to talk a little bit about that you feel would be important to people here? And I love how, which I didn't even know how hospitals played such a major role, but maybe just kind of an overview on what could help an audience when any kind of service is being needed.
Absolutely. Ask questions, talk it through. You have that right as a patient and as a patient advocate, right? Not just as a patient yourself, but if it's a loved one, asking those important questions and doing research. All of that information is documented on Medicare.gov and
Hmm.
making sure it's a right fit. And also know you are in control. I think that's the biggest thing is
Right.
do your research, but also know that if you're not happy with an agency,
Right.
you can change agencies. You have that
Yeah.
right. There's no way of feeling a certain way. Well, they only work with one agency. That's not really fair. You still aren't in control of what services you need. And I think the biggest part to that is that advanced directives. I cannot advocate anymore
Gotcha.
of patients and families and yourself just having that paperwork on
Right.
file. We talk about the 5 Ds, a new decade in age, a death of a loved one, divorce, a new diagnosis, or a decline are kind of the 5 Ds that we talk about. But even prior to that, every year, just take a look at it. Make sure that there hasn't been any changes of who you would want to make those decisions for you. And what does that look like? And I think that's such an important part that we don't talk about it like we used to. And death and dying is natural. We're
Absolutely.
born and to die to a certain
Right.
degree. That's tough to hear, but I think we need to talk about it
Right.
because if you don't talk about it, they might not
Right.
know what your wishes are, and your wishes might be completely different of what their expectations are,
Right.
and they're
Exactly.
the ones making that decisions for you. So even just
Right.
having a conversation
Yeah.
and writing it down. And again, those advanced directives typically are actually provided in the hospital. So asking the social worker or case manager prior to discharge, I don't have advanced directives. Those are documents that they actually have copies, or you can go on the website online and look for advanced directives that typically for your
Hmm.
state that apply for your state. And those are very basic, but at least it lets you make those decisions on who you want to make that level of care. And then you want to provide a copy to the hospital for medical records or your primary care doctor and specialist. And then you want to keep your original, keep a copy like in your car, and then maybe keep an original. I would not say the safe. Actually, commonly we recommend in a tennis ball holder and in the freezer or somewhere where it's accessible to people. So if it ever gets to the point where there's a crisis, you have that written down and people know what your wishes are.
Hmm. When people move, all right, I mean, you often see that they're moving into another state. It's called that sunshine state.
Yes.
They're living as a vacation, which is Lake Orion, but we're also in Pure, Michigan, also, or is it
Yes.
now a water wonderland again? I don't know.
A little mix of both, I think.
Depending. So obviously, wherever they go, because they have those legal documents or those documents in place, it should be honored wherever they are. Any thoughts on any of that?
Yeah. So when you're doing a move like that, if you're going to Florida, Every state does have different rules. I know that living wills are not legal in Michigan. So that's a great point you make as well, too. So that's exactly a great time of when you want to update that. If you're going through an elder law attorney or maybe through insurance, that's a little bit different if you had those documents made, or if you're working with a lawyer. Those typically can be applied everywhere. But when you talk about advanced directives, I still would encourage to do a new set at the new location, whether it's with your primary care doctor or at the hospital. That's your hospital choice that you maybe been at, and ask for a copy. I always encourage to keep the ones you have, but always update that when you're doing a significant move like that.
Okay, very cool. Any final thoughts? It seems like we covered a lot. I knew this was going to be good. I just knew it. I don't know if it was because you're Polish, and I really got to know you a little bit, which is kind of cool. But yeah, let's a lot of times questions are going to be coming up, right? And it could be when we get off this podcast, once we get it online, or over the holidays, right? A lot of families gather together, right? And there's questions, right? So if somebody had a question, and it could be on Christmas Day or whatever that spirited holiday is, if they had a question, tell them, if you don't mind, how they could reach out to you, or if it would be through McLaren Hospital, anything that could benefit them.
Yeah, absolutely. I can provide my direct number to them or my email address.
Why don't you start by doing that? And
absolutely. So I will actually give out my cell phone, and that number is 586-909-7863. And honestly, I am just a resource. So please call me, and I will do my due diligence to answer that question. And if I don't have the answer, that's where my criminal justice comes in. I will find out that answer for you as much as possible. And really, my email would be my first and my last name.
Right, which
Gmail.
is?
Yep, Jadwiga Reffitt.
What is it?
Jadwiga or Yaja Reffitt. At gmail.com, and the spelling of that would be, do you want me to provide the spelling?
Please.
Okay, absolutely.
If you don't mind.
No, not at all. It's JADWIGAREFFITT at gmail.com, and they can absolutely reach out to me as well, and I can answer those questions for them.
Okay. I have to say thank you so much.
Oh, thank you so much, Dennis. You're amazing.
We're very proud of how you can, how you serve people and you make a difference in this world. So stay tuned. If you have any questions, please reach out to her. And may you have a blessed day and enjoy yourself. Take care.